So we are ready for one more session of YouTube live with some case discussion and of course your question answer session. So today I'll discuss one of the interesting case in interesting symptom for which I got very good results in case of simple case of migraine. So I hope everybody joins in early so that we can start. So there was a case, there was a case where the patient had a very interesting symptom. It was a case of migraine headache, and the patient says that whenever I used to get headache, whenever he gets headache, there was a lot of bloating of the face. The face also used to swell up. There was a lot of bloating of the face, and people could know, his family members could know that he will be getting headache because the face looked bloated. And this was a very, very important symptom of that case where the patient said that the bloating of face during headache. Okay, good afternoon, Dr. Indranil. So this symptom is again a very impressive. See, whenever you get symptoms in relation to disease, which is very, very peculiar to that, then you have to take that symptom for consideration because the body is trying to show out symptoms in that form. Yeah, welcome everybody. Welcome Dr. Remy, Dr. Varsha, Dr. Mishra, Dr. So whenever the patient comes to you with some peculiar symptom along with the disease symptom, then it becomes a very, very important symptom to prescribe. Welcome Dr. Anja, Dr. Nathwal, Dr. Palak. So whenever there is bloating, so he came with bloating of face with headache, and I prescribed simple remedy, which is very surprising. It is there basically in the repertory chart, and that is Cactus grandiflorus. Now, whenever you are prescribing Cactus grandiflorus, don't always think about that symptom of heart or caged feeling in the head. There are other symptoms in cactus which are very, very important in relation to lot of conditions. Don't always limit your prescription of Cactus grandiflorus only to heart complaints. It has a variety of complaints. In fact, in Cactus grandiflorus, of course, the symptom of bloating of face during headache is there in cactus also. There are few remedies, but I prescribe cactus. In cactus, if you have read Mater Medica very, very properly, in Cactus grandiflorus, the causation, as we say, is very important. The causation in Cactus grandiflorus, what is the cause of symptoms of Cactus grandiflorus constitution? Anybody? How does a Cactus grandiflorus symptom starts in the constitution? And you'll be surprised. Anybody has the answer? Welcome, Dr. Disha. Good afternoon. So Cactus grandiflorus has causation from disappointed love. Normally, whenever there's disappointed love, we think about remedies. First, we think about acid force and ignitia and natrimony as the remedies. But Cactus grandiflorus also has the same symptom where the causation is disappointment in love. So two symptoms are important: disappointed love and bloating of face during headache. And Cactus grandiflorus 1 potency cured the case in one dose. That is the beauty of Mater Medica. Understanding the remedy is very, very important. Fear of dark and robust ammonium fall remedy, please. Yeah, I'll come to the case, but I was just discussing. Dr. Mujahid, good afternoon. मिश्रा जी हम थोड़ा रेमेडी डिस्कस कर रहे थे कैक्टस ग्रैंडिफलोरस. ये दिखाना चाह रहे थे कि एलिमेंट्स फ्रॉम और कॉजेशन ऑफ कैक्टस ग्रैंडिफलोरस इज ऑल्सो डिसअपॉइंटमेंट इन लव. सेकेंड, there is a very interesting symptom of Cactus grandiflorus, that is the patient cries but does not know for why. Means the patient cries but does not know why the patient is crying, and it is aggravated by consolation. We never think of Cactus grandiflorus because we have other remedies where there is aggravation from consolation, but cactus is a very, very important remedy. So that's why if you say Cactus grandiflorus loves solitude, these four symptoms of Cactus grandiflorus are very, very important that I have seen in my clinical practice. As you must be seeing, my YouTube videos also of Mater Medica are basically those symptoms which I have clinically seen in my practice and has given me good results. Only those symptoms I share. So these symptoms of Cactus grandiflorus, apart from the cage sensation in the heart and the on iron band, these are there. But love disappointment, causation, the patient cries, does not know for why, consolation aggravates, and the patient loves solitude. This is a very, very important symptom of Cactus grandiflorus, and There is always a fear of death for cactus because the patient feels that his disease is incurable. Remember this, remember this. The patient feels that his disease is incurable. I just finished cactus because this was a case, that's why I'm discussing. So, when the patient feels that disease is incurable, that is also cactus grandiflorus. So, I hope you got some inputs of a cactus. Any other symptom which you like to share? Any other symptom which you like to share? That is very, that's very important. Okay, we'll have a questions first because there are a lot of questions which have gone. Fear of dark and robust stramonium fail. See, whenever there is fear of dark or fear of robbers, सी फियर ऑफ डार्क मिश्रा जी अगर आप देखेंगे ना तो बहुत सारे रेमेडीज है. अगर आप कोई भी रेपिटरी खोलेंगे उसमें देखेंगे फियर ऑफ डार्क, तो आपको इतनी रेमेडीज मिलेंगी कि आप कंफ्यूज आएंगे. उसको देखिए कि उसको फियर कैसा है, किस प्रकार का, वो बहुत इंपॉर्टेंट. जैसे हमारे पास रेमेडीज है काली ब्रोम, काली फॉस, पल्सेटिला, वेलेरियाना, ये सब है. ऑफकोर्स देन यू हैव रिटन फियर ऑफ रॉबर्स ऑल्सो. सो अगर आप इसको दो को कंपेयर करते हैं, आई जस्ट टेल यू व्हाट बेसिकली आई हैव सीन इन माई प्रैक्टिस. मैंने जो प्रैक्टिस में देखा वो आपसे शेयर करना चाहूंगा मैं. तो वेन एवर देर इज फियर ऑफ डार्कनेस एंड फियर ऑफ रॉबर्स, एक रेमेडी मिश्रा जी आप हमेशा ध्यान रखना, एंड द रेमेडी इज कालीफॉस. हमेशा नाइट्रोमोर मत दीजिए. नो, नाइट्रोमोर व्हाट यू कॉल द मोस्ट मिसयूज्ड रेमेडी फॉर फियर ऑफ रॉबर्स. आप ध्यान रखिए कि अगर पेशेंट को फियर ऑफ रॉबर्स है और फियर ऑफ डार्क है और रॉबर्स का सपने आते हैं, do think about Califos. Califos has given me very, very good results. And of course, there are so many remedies I'll tell you. You can write down in your Mater Medica. We have arsenic, we have phosphorus, we have natromure, we have kali, I think we have lycopodium, argentum nitricum. बहुत सारी दवाई है. Fear of robbers, fear of dark. But Califos has given me very good results. Fear of darkness is also there. That is the importance of 2 rubrics. If you add 2 rubrics, मिश्रा जी उसको देखिए, arsenic, phosphorus, अर्जेंटम नाइट्रिकम भी है, जिंकम मेटालिकम और नाइट्रोम्यूर भी है. डॉक्टर त्रिवेदी वेलकम. जस्ट अ मिनट सर, वाल्व का स्टेनोसिस और कैल्सिफिकेशन होम्योपैथी से ठीक हो सकता है विद रिगरेडिशन? देखिए डॉक्टर मनीषा जी, सबसे पहले तो हमको देखना है कि उसके वजह से पेशेंट को सिम्टम्स क्या हो रहे हैं. सबसे पहले तो जैसे हनीमैन ने लिखा है ऑर्गेनॉन में कि हमको बीमारी तभी पता पड़ती है साइंस एंड सिम्टम से. तो उसको साइंस एंड सिम्टम देखिए पहले कैसा है. अगर साइंस एंड सिम्टम आपकी मेडिसिन को मैच करता है विद द सिमिलिमम, देन इन होम्योपैथी एवरीथिंग इज पॉसिबल. Believe me, I have such beautiful cases of heart complaints, of cardiomyopathy, of arrhythmias, of tachycardia, supernal tachycardia have given me fantastic results with homeopathy. And I think one of the doctors might be there on WhatsApp or I think on Instagram, and we had a case of, I think, where the LVF was very very low. I don't remember the percentage, and she had a lot of dyspnea, and we gave the remedy, I think, kali nitricum, and the patient felt better within 3-4 days. So this is how you have to take symptoms and use your experience in treating cases in homeopathy. See, most of the disease are curable. Of course, some diseases which are related to surgical conditions, which like if you have hernia and it has come out from the sac, like umbilical, it has come out from, then you require surgical intervention, but it is definitely curable. You must understand the symptoms of the patient and then prescribe. My case of experience on treating neurofibromatosis. Yeah. See, neurofibromatosis, if you see, it is a genetic disorder. It is caused by tumors to form a nerve tissue. Now I have cases where now there are 3 types of neurofibromatosis, like neurofibromatosis, and schwannomatosis. So I have cases where the patient is better, but the patient is not fully cured. So they are under treatment. Welcome, Dr. Saili. One patient is having intense pain and rheumatism from waist to shoulder, okay, and above in the right. After sexual thoughts, he gets relief only after ejaculation, unmarried and suffering a lot from his. Okay, so whenever you feel that the patient is better, it is surprising, the patient is better by ejaculation, surprise thoughts. So you can what you call, take the rubric better by discharges and vital discharges. So you have remedies, like lachesis is there. These remedies basically are very, very important. Now, if you see, there's a doctor where he has written, it is basically a summary. Now, for example, if you see Boger's mathematics, he has written everything in words like amativeness, acridity, biliousness. Now, acridity is not only related to discharge, it is the acrid constitution, the whole person, mentally, physically, both acrid. In the same way, if you say that the patient is better by discharges, so you must see the rubric that discharges ameliorates. Then you have remedies lachesis, you have pulsatilla, you have sulfur, you have calcarea, dulcamar, ipecac. In your case, it is rheumatism. Better by discharges, especially ejaculation. Then you must think about acid phos, very important remedy. Second, zincum metallicum. And third, you should think about sulfur. These three remedies basically are important where the patient is better by discharges, which are very vital for the body, like ejaculation, menstruation. That's how you have to get into the case. So discharge, amelioration, then you have to think about sulfur, zincum metallicum, and phosphoric acid. Of course, dulcamar is also there. Small joint pain, for you can think about actia racemosa, kali iode, erenia diadana, Dr. Trivedi. Dr. Sir, cervical pain, amelioration from bending head backwards and heart pressure. Now, I think I had told you one of the remedies, where the patient said that there's a lot of pain in the eye, which is better by bending the neck backwards. Can anybody guess the remedy? Anybody? Very, very interesting remedy, a very, very what you call rare remedy, and it fantastically, it had given results with that. Anybody, can we have the remedy? Anybody? Okay, oh, fine. Please go home and do read about this symptom, very, very important. So we have the case where the patient, Rutano, it was other remedies. Cervical, Dr. Akhtar. Three remedies, very, very important. You should remember. First is hypericum. The second is Senega. And there is one important remedy, which is very rare, rare. That is, I think it is Cybac orientalis, which is very rare remedy, but two remedies are important. One is hypericum and second is Senega. Which remedy has the most fear of death because of illness? Fear of death because of illness. Now see, fear of death. If you go and see fear of death because of illness, then basically you have to differentiate which type of illness. If the patient says because of coryza, I think I'll die. So the patient is very, very hypersensitive. That type of. And sometimes the patient is suffering from cancer, or the patient is suffering from heart disease or any terminal illness. And then the patient says that he has fear of death, and that fear of death basically is accepted because he has that problem. So you have to differentiate, and you have to, it's a long COVID. So you have to differentiate and understand when you have to take the symptom of fear of death. Normal fear of death because of illness, there are 3-4 remedies, very, very important. First, think about arsenic. Second, think about aconite. Third, think about calcarea carb. And fourth, think about phosphorus. No, not fagopirin, it was Senega only. Kali nitrate was also given good results in interstitial nephritis with, severe colic and crying cured by cactus. Very nice. बहुत अच्छा मिश्रा जी आपने बताया, तो हमको भी सीखने मिलता. Thank you. Patient comments of some irritation in throat which causes cough, but person sitting next to the patient can hear the breathe. Please suggest something. See, I had told you one remedy, that is kathar in the larynx. So in that case, when the patient start breathing, and and the person sitting next to him can hear, which was the remedy? I had told you a case which was admitted in the hospital, and we took this because when he was breathing, there was voice from the throat. So we took the symptom kathar from the larynx, and then we cured the case. Anybody remembers which was the remedy? Anybody? So the remedy which we took for prescription was very, very, no, not Kalibakaram, kathar of the throat, the larynx. So we had, no, it was Senega. I told you it was Senega, kathar of the larynx. So, of course, Ipecac, Calibachrome, graphitis, arsenic, hipposulf are there. But a very, very classical remedy which I have got very, very good results when there is catarrh in the throat, especially larynx, the remedy is Seneca. 48222017 joint, welcome. Long COVID, yes. Fagoparin, no. Parth, BP 160/90, he is lachesis de sakte, he one dose. Yeah. If the case corresponds, if the similarity is there, it will definitely work, and it can work in few hours only. So if the lachesis is there, and lachesis is a very wonderful remedy for any disorders related to blood, mostly it is given. And of course, BP is there, so you can definitely give lachesis. It would work, single dose should work. But see, after that dose, how does the patient respond? If the patient says the BP was okay, I was feeling better for 8 to 10 days, then you may need to repeat the medicine. So follow-up is very important in these type of cases. So call the patient weekly at your OPD and keep checking the blood pressure, so you can know the action of the remedy. So in different constitution, in different personality, the remedy would have different action depending on the severity and the susceptibility of the patient. Yeah, Dr. Rizvi, good afternoon. So that's what we were talking about catarrh. Can we have other questions? Today I had a very interesting case, of sleep apnea, and because of that, the patient's mouth becomes very dry. It becomes so dry that the patient has to wake up from the sleep and drink water. He's a child of, I think, 18 years of age, very healthy. So I've just prescribed the remedy, and hopefully let's see the follow-up after a month. How does the patient react? A very interesting case of sleep apnea. Dr. Mayank Goyal, welcome. Good afternoon. Yeah, you can ask a few questions which have been scrolled up so that I can answer it properly. I hope you understood something about fear of death. Fear of death. First, make the symptom whether to take that symptom for prescription, or basically it's a normal symptom. That's important. Like for instance, we have symptoms in the remedy, that fear of going to the dentist. So most of us used to feel fear to go to a dentist because it is a very painful condition. So remedies like calcarea, pulsatilla, tuberculin are there. Now dentist is also a doctor, so you can club that and say that dentist is a doctor also. There are a lot of combination in these type of complaints. Depends how you interpret that symptom. Welcome, Sultan. Sir, middle-aged person with hypertension 169 having no symptom, how to approach? Yeah, such an important, Dr. Indranil, important question. And the answer of that question lies in your question only. A person having BP so much 160/90 and no symptom, that means the patient is very tolerant. The patient has emotional baggage which he cannot take it out. So every emotions, every grief, every sadness is suppressed. Maybe the patient is very precocious, he is very diligent, or he is an elder in the family, or is to support a lot of person, or he is running a group where he cannot discuss his emotion, he cannot take out his emotions. So the body has become tolerant because of lot of years. That's why in these persons we don't have any symptoms, and suddenly one day the patient comes to you and say, oh, yesterday I got a heart attack and my brother admitted to the hospital. So in these type of cases, it is very important to understand why is the patient so much tolerant and what are the emotions the patient has suppressed, and the remedy will help in blood pressure also, and will be able to take out his emotions through the Hering's law of cure, so the patient feels mentally and physically very calm. So the question of the answer lies in your question, Dr. Indranil. A very interesting question. Dr. Myanmar, welcome. Dr. Shivam Tripathi. Yeah, welcome. I hope you understood. See, whenever the patient comes to you with symptoms, it is so important to understand first why the patient is having the symptom, why the patient is speaking that language, and why that patient suffers from such type of diseases. That's how you have to enter the case. Every case, see, to enter has a different entry point. That's the art of case taking, as we see, which cannot be learned by performers. Okay, I have made a good performer, how to understand the case, how to do case taking. No performer is going to teach you case taking. The case taking depends on the patient who has entered your chamber. How is the aura of the patient? How the patient is talking? how the patient is behaving, and which disease the patient is having. And then you have to ask your questionnaire. Of course, the questionnaire which Hahnemann has told is there, but then entry point depends on how you have interpreted that case, and that's how Homeopathy is told that it is an art and science both. So performers will never help you to understand the case. The patient himself will tell you the weaknesses of him so that you can enter that case and then prescribe. So case taking is very important. This is called as maybe sometimes non-verbal case taking, and you can enter through a case through non-verbal case taking also. Understanding why is behaving that way, understanding the skin, the hairs, the face. The face also will wrinkled face and old looking face and haggard face, eyes, ears. There are a lot of symptoms to enter. So whatever a patient comes to you, it is very individualistic, and that would really help you to understand and to prescribe depending on what the patient has come from. I hope, Dr. Indranil, you could understand some. Everybody, case taking, a lot of people, a lot of students who have come and joined me ask me, sir, is there any proforma of case taking? How to do case taking? And I always say case taking cannot be learned by proformas and what is written in there. It is basically very individualistic, and it is very interesting how the patient speaks to you and what is behind the patient, what he wants to talk to you. That is also very important. Okay, I hope everybody got some understanding what I want to tell you. Yes, again, any other question? Or you could share some of the cases where sir, two pathologies like rheumatism and psoriasis together, how to, see, first of all, if there is psoriasis and it is not treated properly, patient lands up in arthritis. That is called as psoriatic arthritis. So whenever you are treating a case of psoriatic arthritis, the arthritis first gets better, the psoriasis increases because it is exteriorization of the symptoms, and then automatically the psoriasis gets cured. So it is psoriatic arthritis because psoriasis, if it is not cured or suppressed, goes inside the bone and we get psoriatic arthritis. So it is basically a syphilitic case, or a frank syphilitic case. So case taking has to be that syphilitic part of case taking. And psoriasis it's wonderfully cured with homeopathy, though I cannot claim that I cure all the cases of psoriasis, but in my OPD I have got fantastic cases of psoriasis cured with homeopathy with the proper case taking. As I've always told, I had a very interesting seminar on Instagram, and if you have heard that seminar on Instagram, you definitely must hear it again, because a lot of people have given their reviews after they have heard the seminars, and when they have prescribed on these, they have really found very useful tips and good understanding of the patient's nature and the disease, and they're getting good results with that. So you go on Instagram, and I have a whole session of psoriasis for an hour. I did for among the doctors. So you go and definitely hear that psoriasis, and you will definitely get something more out of that Instagram live. Can you please share the link of that seminar on Instagram? I think we shared the link on the Instagram. I think we shared the link, but okay, I'll share it back to you, and let's see. I'll tell my assistant to share that link with you. We had shared that link. Okay. Because there are a lot of webinars, coming up. So I exactly don't know which date it was there, but it was definitely there, and a lot of people have liked it. So I share that. I'll tell my assistant to share that link to you, Dr. Vishaka. Yeah. So I was telling something where, this is a very common symptom. The patient wakes up in the morning, the mother or the wife or the children say, "Oh, daddy, your face appears so bloated." In Hindi it is told, हमारे बोलते हैं कहावत, फेस पे बहुत थोतर दिखती है. थोतर, फेस पूरा सुजाव फेस रखता है. Of course, if it is hypothyroidism, it's okay. But these symptoms are very, very important. Bloated face. Whenever there is fear, there is bloating. Headache, there is bloating. Or when the patient starts talking, the face starts to swell up. So these symptoms you can see from the patient, in the morning, evening, night, or anything. So what you can see, I have seen a lot of cases where the patient has bloating, and then the parents come and say, "My son's face appears so bloated in the morning, and then gradually it comes down." Why is that, doctors? You test a lot of things and nothing is there, but then you prescribe some remedies like bloating of the face. You have, especially in the morning, you get up. We have natrum calm, we have spagilia, we have agaricus, we have a very rare remedy also which I have used in those conditions. Hura. The remedy's name is Hura, Brazilians. So one question, I'll just finish that question first. Patient seems to have an oral cancer but is afraid to go for biopsy. Patient is also having locked jaw. Past history of taking Rajnigandha suggests something. See, oral cancer. So we are treating basically, of course, if the patient does not want to go for biopsy, it hardly matters to us. Basically, it's a diagnosed case of oral cancer. So it is for us, it's basically a syphilitic case, and out and out syphilitic, syphilitic case taking has to be done. Now, in this case, of course, if you ask me to prescribe remedies, basically which are very specific, I have not got some specificity of that. But if you feel that the patient, and I'll discuss a case where the patient had oral cancer already operated, and after that also he started taking tobacco, and again it was swelled up. There was bleeding ulcers, and there was a lot of discharge and all. So a simple remedy which I gave in that case was only the symptoms was anthraxinum with a lot of ulceration, clogging, and burning. Anthraxinum worked beautifully. The whole symptomatology came down. The patient was better, though the psoriasis was not, the cancer was not cured, but symptomatically patient was better. As I can only tell you the symptomatic relief because the whole case is not there. In case of cancer of throat, cancer of mouth with oral, you may think about remedies like Lobelia inflata, tabacum, arsenic, anthraxinum, and there are some remedies which are basically very, very interesting. You must go home and read that. That is kali cyanide. Kali cyanide is again a very interesting remedy. It is kali cyanide, potassium cyanide, which cause basically a lot of degeneration and a lot of ulceration and a lot of burning and oral cancer. And oral cancer, there is a lot of burning. So you can think about kali cyanide, you can think about arsenic, anthraxinum, you can think about, as I told you, tabacum and lobelia also, which will give you good results. Okay, whatever I could guess from your question. Dr. Fatima, welcome. Waking in morning and disturbed mind up to half an hour, lachesis हो सकता है क्या? See, whenever the patient is, or you can simple write unrefreshing sleep. Now, if you have unrefreshing sleep, especially in the morning, now it is very, very interesting. There is a symptom which is called unrefreshing sleep 1, but you have written Dr. Mishra savere. Okay, तो अगर आप देखेंगे वेकिंग एग्रेवेट्स, और सवेरे पे उठता है तो बहुत चिड़चिड़ा लगता है, कुछ काम करने की इच्छा नहीं होती, एक्सवाइड लैकेसिस तो इंडिकेटेड है, बट और एक रेमेडी बहुत इंपॉर्टेंट है, नख स्वामी का बहुत इंपॉर्टेंट रेमेडी है. वेक पेशेंट उठा के उसका चालू हो जाता है. ऑफकोर्स इफ द स्लीप इज अनरिफ्रेशिंग, then you can think about sulfur. आप नैट्रम्यूर सोच सकते हैं, नक्सवामी तो मैंने बता दिया आपको, सीपिया सोच सकते हैं, लैकेसिस सोच सकते हैं, बट लैकेसिस, नक्सवामी का, सल्फर और नैट्रम्यूर, ये 4 दवाई आपको पढ़ना चाहिए. इसके अंदर बहुत कुछ कवर हो जाता है और बहुत अच्छे आपको रिजल्ट्स मिलेंगे इसके अंदर. और आगे बढ़ते हम. मिश्रा जी, आपको समझा? आपको कुछ मिला रेमेडीज? मैं इसलिए बहुत सारे रेमेडीज नहीं बताया बिकॉज बहुत बताऊंगा तो आप बोर हो जाएंगे. बट ये 4-5 रेमेडी अगर आप देखेंगे बाई चांस, इफ यू हैव सीन, समझो रेपिटरीज विच आर स्मॉल रेपिटरीज, फॉर एग्जाम्पल इफ यू हैव सीन बोगर रेपिटरीज, फाटक रेपिटरीज, जब भी पेशेंट सो के उठता है आप लिख लीजिए, और एग्रेवेशन है, कोई भी बीमारी हो, 4-5 दवाई मिश्रा जी बहुत इंपॉर्टेंट है. लैकेसिस, नक्सोमिका, लाइकोपोडियम, सल्फर, स्पॉन्जिया, एंड बस ये 4-5 रेमेडी बहुत बहुत इंपॉर्टेंट है. वेकिंग एग्रेवेट्स, और अगर आप ये देखेंगे, आई थिंक बोगर रेपिटरी के अंदर एक वर्ड दिया है वेकिंग एग्रेवेट्स, और 8-10 रेमेडीज है, उसके अंदर ये 4-5 रेमेडी बहुत इंपॉर्टेंट है. चाहे पेशेंट को बीमारी कोई भी हो, अगर पेशेंट उठ के बोलता है कि मेरे को सवेरे उठने से आंख में भारीपन लगता है, बहुत सर दुखता है, उठने की इच्छा नहीं होती, ऐसा चिड़चिड़ लगता है, ऐसा लगता है सो जाना चाहिए, मेरी सुबह ही होती है पूरी बीमारियों से, तो ये 4-5 रेमेडी आपको सोचना चाहिए, बहुत अच्छे रिजल्ट्स मिलेंगे इसकी तरह को. रेफरेंस 23 ज्वाइंट, वेलकम. सो एनी अदर क्वेश्चंस? I hope you understood my answer. So if you understand my answer and what I want to tell you clinically, then we can basically discuss more. Sir, can we join your Mathematica group discussion and how to join? Yeah, Dr. Indra, I will tell my fellow doctors to join you in that group. You can send me your WhatsApp number and I'll make sure that you join that. Of late, ये मटेरियल ग्रुप के अंदर में मैं कुछ ज़्यादा डाल नहीं पा रहा हूँ केसेस, बिकॉज ऑफ द टाइम कंस्ट्रेंट्स एंड ऑल, बिकॉज ऑफ द लॉट ऑफ केस टेकिंग्स एंड ऑल. तो मैं लेकिन आई विल डिस्कस बेसिकली, डोंट वरी अबाउट दैट. आपका नंबर डाल देंगे, नंबर भेज दीजिए. सो आई थिंक any questions which I have not answered, which have scrolled up, what I'm seeing on Instagram, I think few questions have scrolled up which I could not. Yeah, Dr. Sharon, Dr. Trivedi, Dr. Saili, Dr. Fatima, everybody's there. So I think that's all. I think all the questions are answered, and I hope you enjoyed hearing the YouTube live, as I enjoy teaching you and sharing my knowledge with you and understanding your sometimes question answers and your cure. So that also gives me good feedback that whatever I want to speak to you is going to, and you are basically enjoying in your practice and you're applying that in your practice. So thank you very much. Thank you for joining.